Hi there, Nurse Master Charlie here. Every Wednesday, I've been sharing about the different types of diabetes. This is the fourth and last video in the series. Don't forget to watch the videos on prediabetes, diabetes type 1, and type 2. You can find those videos on YouTube, Instagram, and TikTok. Now I'm going to finish up with gestational diabetes, also known as GDM. So what is gestational diabetes mellitus, or GDM for short? This is a type of diabetes that occurs in pregnancy. So first, a woman can have diabetes before she gets pregnant. These are technically called pre-existing type 1, pre-existing type 2, or pre-existing prediabetes, or as having pre-gestational diabetes, which is like the name implies, where a woman already has type 1, type 2, or prediabetes that existed before she became pregnant. If a woman did not have diabetes prior to becoming pregnant, but it is then discovered in pregnancy, she is defined as having gestational diabetes. Gestational diabetes is defined as any degree of glucose intolerance with the onset or first recognition during pregnancy. So how common is gestational diabetes? In the United States, 7 to 10% of pregnancies are affected by gestational diabetes. And of those, 50% truly have gestational diabetes. 24% have pre-existing type 2 diabetes, 24% unknowingly have type 2 diabetes, and approximately 2% have diabetes type 1. Now these percentages will vary depending from where and when you look at the data, but all are very similar statistics. So how is it determined that a woman has gestational diabetes? So first, there is a screening algorithm that classifies pregnant women into low, average, and high risk categories. Pregnant women are generally screened for gestational diabetes at 24 to 28 weeks gestation with the use of an oral glucose tolerance test, which is kind of like drinking a very sweet soda. Now, in the two-step screening method, a non-fasting 50-gram oral glucose challenge is given to the patient, meaning they drink the sweet soda. Then blood work or lab work is obtained from the patient. Now, according to the American Diabetes Association, if the patient's results are less than 135 to 140, she does not have gestational diabetes at this time. If the results are greater than 140 but less than 200, then the second step of the test is given, which is an administration of a 100-gram oral glucose tolerance test, kind of like doubling the sweet soda. Now, gestational diabetes is diagnosed if 2 or more of the following levels are higher than 95 milligrams per deciliter at fasting, 180 milligrams per deciliter at 1 hour, 155 milligrams per deciliter at 2 hours, or 140 milligrams per deciliter at 3 hours. Now, if a woman is positive for gestational diabetes, she will then need to monitor her blood glucose levels 4 times daily. This is at fasting, 1 hour after breakfast, 1 hour after lunch, 1 after dinner. In addition to testing her blood glucose levels, she will need to adhere to a healthy diet, monitor her carbohydrate intake, and exercise such as walking if it's not contraindicated. So what causes gestational diabetes? In gestational diabetes, pregnancy hormones such as estrogen, progesterone, cortisol, human placental lactogen, these contribute to insulin resistance. This resistance does not allow a woman's body to utilize the insulin which it usually would, which in turn causes elevated blood glucose levels. In a non-diabetes pregnancy, a woman is able to produce about 3 times the normal amount of insulin to control her blood glucose levels. In gestational diabetes, a woman can only produce about 1/3 of the amount needed. It is not known what causes gestational diabetes, but there are risk factors such as age, ethnicity, genetics, obesity, prior history of gestational diabetes, family history of diabetes type 2, or having a large baby in a previous pregnancy. So if you recently tested positive for gestational diabetes, it is not caused because a woman had a piece of cake or ate something sweet or drank a soda a few days before the test. It is due to hormones, and they are the same hormones that maintain a pregnancy, so women do need them. So what are the increased risk and complications of gestational diabetes for the mamas? These complications could include headache, hypertension, polyhydramnios, or too much amniotic fluid, preeclampsia, HELP syndrome, preterm delivery, C-section, PUP, and ICP. So what are the complications of gestational diabetes for the baby? And why is it so bad if a baby is absorbing too much glucose or sugar? Glucose from the mother as well as other nutrients pass through the placenta and into the developing baby. The baby's pancreas then begins to produce extra insulin to counter the excessive sugar in their circulation. As this extra sugar is not needed at the time, their body will begin to store it for later and begins to convert the sugar to fat, which in turn makes a baby bigger, as defined as 9 pounds or more. Now, having a big baby increases the risk of cesarean section. If delivered vaginally or naturally, then possibly increased pain for the mother during delivery. But the baby is also at increased risk of shoulder dystocia. This is where, as the baby is being delivered, the shoulders get stuck, causing a delay in their birth. The baby cannot begin to breathe oxygen on their own until their body is delivered outside of the mother. The larger the baby, the more difficult it may be to deliver the baby. Also, clavicular or collarbone fractures may occur. Now, other complications for the baby that can occur and that are associated with gestational diabetes are respiratory distress or difficulty breathing, hypoglycemia or low blood glucose, which can lead to seizures, also hypocalcemia or low calcium, preterm delivery, and also stillbirth. Gestational diabetes can also put the baby at increased risk of possible future issues of diabetes and obesity later in life. How is gestational diabetes treated, and how do women with gestational diabetes prevent these complications? Gestational diabetes is treated by following a diet, exercising, and taking medications such as certain oral medications or insulin to help control blood glucose levels. Insulin is the preferred medication. Also by keeping their appointments with their OB/GYN physicians and diabetes educators, maintaining a healthy diet as directed, exercising as tolerated, monitoring their blood glucose levels as directed, taking medications such as insulin if needed. What happens after delivery of the baby? If a woman did not have any type of diabetes before pregnancy, she should theoretically return to not having diabetes after pregnancy, unless she was in the category where 24% of pregnant women actually had type 2 diabetes but did not know it prior to pregnancy. Now, a woman with strictly gestational diabetes has a 50% chance of having it in future pregnancies and a 50% chance of developing type 2 diabetes within 5 years. So use this as a warning sign that says diabetes ahead to make lifestyle changes now. Now be sure to watch and listen to my diabetes related lyric videos on YouTube of my songs What is Diabetes, Check Your Feet, and the A1C song. They are also available on your favorite music streaming platforms. So I hope you learned a little something. Thank you for watching. Be sure to like, comment, subscribe, and share this video. Remember, stay safe, but not too sweet.